Lancaster General Health looks at the next year and the next several years as really exciting times for us. We know with the Affordable Care Act, the number of new patients coming into healthcare and requiring services will rise dramatically. We know a number of people that didn't have the kind of access historically will be looking for healthcare services. So we're planning a solid growth strategy over the next 3 to 5 years. Lancaster General is making a lot of changes in order to be able to provide services for this new influx of patients and also serve the patients that we currently do. We're moving toward a population health management environment where we're looking to manage a population and take responsibility for all of their health care rather than just be a provider of interventional care, if you will. Having said that, we're making tremendous investments in infrastructure as it relates to the electronic health record. That alone, the investment was over $150 million. We've just built a new cancer center, which will allow our community to get about 99% of its cancer care right here. We've invested in hybrid ORs and lots of technology in that regard. In addition to that, we've invested in other services like wellness services. We're also creating a distributed network where we're putting urgent care, walk-in clinics, ambulatory care services within about 10 minutes of every member of our community. So we're making those kinds of infrastructure and investments to be available in the future. The biggest challenge with the Affordable Care Act is that a significant amount of resource constraint is built into the law. So we're going to have to figure out ways to provide more services for a lot less money. We're excited about that challenge, but that challenge is going to take engagement by the community, engagement by our physicians, engagement by our staff as we think of new ways and more creative ways to deliver health care. You know, the business model that we have is 45 years old. It's really exciting to have a new business model that we can really think differently about the way we provide services to our community. Probably one of the most exciting things, and maybe terrifying for an older person like me, is the ability to access your medical record through a web portal. We have almost 50,000 people now that can talk to their physician, get their medical results, and make appointments through the web portal. They have all of the last 10 years of their medical record available online if they receive services within our health system. So it's really an exciting time. The other thing is that physicians are able to communicate in a completely new way with each other. We know how many patients say that have diabetes in a practice. We know that of those number, how many are non-compliant with their medications. So we can really help those 10 people, say, get compliant like the other 200 in the practice. The one thing I'd like the people of Lancaster to know and remember about Lancaster General Health is that we want to deliver on the promise of a healthier future. We want to engage with them to transform their lives so that they're healthier and better off than they were before. And the way we have to do that is to work on things like wellness and staying healthy as much as possible, but be there in those difficult times when they really need our healthcare services.